Left ventricle. The left ventricle is one of four chambers, two atria and two ventricles, in the human heart. It receives oxygenated blood from the left atrium via the mitral valve and pumps it into the aorta via the aortic valve. And this is a video of a little, it's an explanation of left ventricle.
So moving on to the left ventricle, just a bit about its position. So remember the heart is angled in the mediastinum, so the right ventricle forms most of the anterior surface, and the left ventricle, which is this part of the heart, actually sits a bit posterior to the right ventricle, and it sits anterior to the left atrium. So that's just a bit about the position of the left ventricle. So,
well, that is all we have to know about the left ventricle. Applications in medicine. For excellence of health, the left ventricular muscle must contract rapidly and forcibly to force the majority of this blood into the aorta, overcoming the much higher aortic pressure and the extra pressure required to stretch the aorta and other major arteries enough to expand and make room for the sudden increase in blood volume. For example, in the systolic contraction and ejection. It has to be able to rapidly increase or decrease its pumping capacity under nervous system control. Relax very rapidly after each contraction so as to fill rapidly with oxygen blood flowing from the lung veins. For example, diastolic relaxation and filling. In the pros and cons, typically healthy adult heart pumping volume in 5 liters per minute. Rest. Maximum capacity pumping volume extends from 25 liters for non-athletes to as high as 45 liters per minute for Olympic level athletes. This is another video for an echo of this is how the left ventricle pumped up the blood. So that's all. Applications. Clinical applications of left ventricular opacification. The significant advance made in ultrasound microbubble technology now permits reliable, reproducible left ventricular opacification, and this review reiterates the evidence that has shown contrast echocardiography to be clinically effective, to reduce downstream costs, and to spare patients further. Potentially hazardous investigations. Despite the evidence and the advances, there remains ambivalence towards the administration of contrast agents in echocardiography laboratories throughout the world, particularly in the performance of rest studies. Therefore, this review also addresses some of the reasons for the suboptimal uptake of contrast agents and encourages physicians, sonographers, and accreditory bodies to adopt a different approach towards the difficult-to-image patient. It's another video about left ventricular opacification, I hope.
Here's a view of the opened right and left ventricles again. Here is the right ventricle, here is the interventricular septum, and here or mitral valve, also known as the left AV valve, the left atrioventricular valve. And the features that you see here are similar to the features we noted already in the right ventricle. So you can see the chordae tendineae, the papillary muscles, trabeculae carneae. All those features are also seen in the left ventricle.
Okay, so, and thanks. My name is Mercedes Paladines Gallegos.